Hello, my desk guardians. I hope you all are fine and enjoying a very safe and sound health. Today, we will discuss about types of inflammation in detail. In previous video, we learned inflammation is non-specific host protective mechanism to get rid of foreign invaders and damaged tissues. Inflammation is basically of two types. One is acute inflammation while other is chronic inflammation. So now we will discuss them one by one. So now we will see some comparison of salient features of inflammation. So first of all, we will see that acute inflammation is very short time course while chronic inflammation has longer time period. Acute inflammation is non-specific immune response while chronic inflammation is specific immune response. Acute inflammation is stereotype response while chronic inflammation is variable response. Acute inflammation is vascular response and fluid production, while chronic inflammation has cells which are macrophage and fibroblast, so obviously they will have fibrous tissue production. Acute inflammation is occasionally necrosis, while chronic inflammation is always necrosis. First of all, we will start from acute inflammation, and if we see purpose of acute inflammation, then they are eliminate injurious agents and their spread, to remove necrotic cells and tissues, and to initiate repairing process. We all know that there are four macroscopic features of inflammation we discussed in almost every previous video, which are redness, pain, edema, and warmth of the swollen area. Acute inflammation depends upon two events, which are vascular events and cellular events, which are generated by leukocytes. Vascular events of acute inflammation consist of two steps. First is to increase blood flow at site of inflammation, and second is to increase in permeability. First step, or increased blood flow, occur when a tissue is injured. It releases nitric oxide and histamine, which causes vasodilation. Hence, vasodilation will promote increased blood flow at site of inflammation. When blood flow increases, it will promote more amount of blood cells, which will cause local stasis of blood, and in result, vascular permeability will increase due to contraction of endothelial cells. Lymphatics also play a very important role in vascular events. There is increase in lymph flow due to excess fluid accumulation in interstitial spaces, and increased proliferation of lymph vessels to compensate the increased load, and lymph node may become large due to hyperplasia. Cellular events occur in three steps. First is recruitment of leukocytes to site of inflammation, second is recognition of offending agent, and third is removal of offending agents. First, let's discuss about recruitment of leukocytes, which is further divided into three steps: adhesion of leukocytes to endothelium, transmigration of leukocytes to interstitium, and chemotaxis of leukocytes towards site of inflammation. Tumor necrosis factor, or TNF, and interleukin 1 or IL-1 plays important role in first step because they play major role for selectin proteins. Examples of selectin proteins are leukocytes as L-selectins, platelets as P-selectins. Transmigration is firmly movement of leukocytes attached to endothelium to interstitial space. Adherent molecules like PECAM and CD31 facilitate it, along with collagenases, which dissolve basement membrane. And last step of first cellular factor, which was recruitment of leukocytes, include exogenous and endogenous factors. Exogenous factors are chemokines and arachidonic acid, while exogenous factors are bacterial products like lipids and peptides. Now, second step of cellular events is recognition of offending agents. There are certain receptors to identify offending agents. Toll-like receptors include bacterial lipopolysaccharides, bacterial proteoglycan, and double-stranded RNA in viruses. G-protein coupled receptor proteins usually recognize substances produced by hosts such as prostaglandins, platelet activity factor, and leukotrienes. Receptors of opsins include proteins which cope with bacterium during opsonizations, such as antibodies and complement proteins, while receptors of cytokines contain cytokines which help against microbes. Final or third step of cellular events is removal of offending agents. Phagocytosis and intracellular killings are ways of removal of offending agents. Firstly, they will be attached by removal agent, then engulfing, and last step is killing and degradation, which we studied in our first video of inflammation. Now lastly, we will see differences between exudate and transudate. Exudate is fluid formed due to increased permeability, while transudate is fluid formed during imbalance between hydrostatic and osmotic forces. Exudate has high protein content, while transudate has very low protein content. Exudate has high neutrophil content and rich in cellular debris, so they have high specific gravity, while transudate has little or no cellular material, so they will have low specific gravity. Exudate are clinically expressed as non-pitting edema, while transudate are clinically expressed as pitting edema. Now we will discuss chronic inflammation. As we learned in inflammation video part 1 that chronic inflammation is long duration characteristic feature as compared to acute inflammation. First of all, we will discuss causes of chronic inflammation. First cause is persistent infection which are prolonged and difficult to remove. Common examples are Mycobacterium tuberculosis which causes tuberculosis, Mycobacterium leprae which causes leprosy, Treponema pallidum which causes syphilis. Some fungi and some parasites are also examples. They all evoke type 4 hypersensitivity reactions. Second cause is persistent indigestible material which can be endogenous involving necrotic bone and necrotic adipose tissue, or exogenous involving silica, asbestos fibers and suture materials. Next type of inflammation is immune mediated reaction, which are further categorized into autoimmune reaction in which immune response occur against our own body antigens. Second is organ transplant rejection in which immune response against antigens of donor organ. Third is unregulated immune response such as inflammatory bowel disease. And fourth one is hypersensitivity reaction in which inappropriate immune response to generally harmless antigens such as bronchial asthma and hypersensitivity pneumonitis. Fourth cause of chronic inflammation is following acute inflammation response, for example, persistent abscesses. Fifth cause is repeated episodes of acute inflammation. For example, repeated attacks of acute pancreatitis leads to chronic pancreatitis in chronic alcohol abusers. Now let's see what is role of macrophages in chronic inflammation. During chronic inflammation, macrophages accumulate at site of inflammation by following processes. Continuous recruitment from blood to site of inflammation. Actually, macrophages are derived from blood monocytes. From blood to tissue, macrophages formation is most important source of macrophage, which is mediated by TGF and PDGF. Second mechanism is proliferation of macrophage at site of inflammation, and third mechanism is immobilization of macrophage at site of inflammation to prevent them migrating, which is mediated by MIF secreted by T lymphocytes. Macrophage has to get activated to perform its function, which is done by interferon gamma secreted by activated T cells and some exotoxins secreted by pathogens. Activated macrophage has several functions, which is to secrete destructive agents to get rid of offending agents we studied just before. These agents are reactive oxygen species, nitric oxide, proteases, arachidonic acid, and coagulation factors. Activated macrophages also increase phagocytic ability and also promote growth promoting agents such as growth factors like PDGF, FGF, TGF beta, and angiogenesis factors like vascular endothelial growth factor for repairing process. Now we will see some morphological and clinical features of chronic inflammation. Morphological features are further divided into two parts. One is macroscopic and other is microscopic. Macroscopic features of chronic inflammation are involvement of epithelial surface as in ulcer, and second is parenchymal tissue as in cavitatory lesions. Third one is chronic abscesses. Fourth one is abscesses extend to surface of distracting tissue in between as in sinuses in osteomyelitis. Fifth one is connection of two epithelial surfaces as in fistula formation. And if we talk about microscopic functions, they are mononuclear cell infiltration, tissue necrosis, tissue regeneration, granulation and fibrous tissue, and ingranulomatous inflammation. Now let's see some common clinical manifestations caused by chronic inflammation. Some of them we discussed in microscopic and macroscopic features. They include ulceration of epithelial surfaces, sinus and fistula formation, formation of cavitatory lesions, loss of function, well thickening of hollow organs, stricture formation, distortion of organ, fibrous adhesion formation, and arteritis obliterans, metaplasia, splenomegaly and hepatomegaly, lymphadenopathy, amyloidosis, anemia of chronic diseases, high ESR, low-grade long-term fever, and loss of appetite and weight. So this was part 2 of inflammation, having acute and chronic inflammation. I hope you now better understand about inflammation. I have given part 1 inflammation link below in description. So this was all about today. If you like this video, then please don't hesitate to comment in the comment section, and don't forget to like, comment and share with your friends. So see you all in the next video. Till then, keep smiling. Thank you.